Svetlana Kogan, thank you so much for being here.
Thank
Now,
you so much.
You know how I like to get free therapy for everybody?
Really?
What about a little free medical care? Well, or at least medical advice, right? The good doctor is here, and you're here locally in the New York area?
That's right. That's
Okay.
right. I'm in private practice. I'm board-certified internal medicine physician on the Upper West Side. I have a holistic practice, which means that, aside from being a conventional Western-trained physician and performing all the conventional diagnostic tests and treatments, I also espouse to a holistic view of the human being, which means looking at you as a big picture, considering your lifestyle, your habits.
So you actually spend time with your patients?
I try to.
How refreshing.
I do my best.
Dr. Svetlana Kogan is a board-certified internal medicine professional, and she's from Cornell University. And you're affiliated with the Lenox Hill Hospital. And in fact, I've seen that on you founded the Doctors at Trump Place in New York City.
That's right.
Okay. All right. Well, I understand that you can talk to us about a number of topics today. By the way, if you guys have any medical questions to ask, please email in the last 15 minutes or so of the show. You know how we like to bring the doctors in and get a little free care, some advice. We love that. We sometimes will Skype with doctors and therapists and whatnot. My number one question for you is about this new swine flu vaccine. Yesterday, I don't know if y'all saw this, but people started getting the swine flu vaccines as part of the guinea pig experiment to see if they actually work and if there are any side effects. Dr. Kogan, I know that we have to do it this way, but how dangerous is this?
Well, I tell you, I have a first-hand experience with swine flu. I had it, and there are not too many people around who are health professionals who had it. I did, and so did my 8-year-old daughter. We had this on the Memorial Day. It was a disastrous experience, both from the standpoint of a patient. We went to the hospital because both of us were violently sick, and I was holding her in my arms, so I went to the pediatric ER. We did not get swabbed because the policy of the CDC is not to swab people who have the viral disease.
Why not?
Who knows? Who knows? I'm
I'm
vehemently opposed to this approach as a
maybe
physician.
they don't want to spread it, or
I think there are not enough swabs, and also they didn't want the panic.
Whoa. Dr. Kogan, are you trying to tell me that the CDC doesn't want hospitals across the country to swab for swine flu because they don't have enough swabs? Bring your own swab?
It's difficult for me to fathom how a superpower like ours, with billions of dollars channeled towards the healthcare, does not have enough swabs. I had swabs in my office, so what I did is immediately when I went home, I went to the office, got the swabs, and that's how I diagnosed my family.
So you sent those into the lab, and you had to do it yourself.
And also,
how sick were you?
We were extremely sick. We were coughing, severely febrile, 104 fever, throwing up. And we did not go past the emergency room because the policy was to tell people to go home and take Tylenol.
They don't want you infecting an entire emergency room because the minute you cough, that could spread 100 feet.
That's correct. So if you're dying, they're going to put you on life support and take you to the hospital, admit you. But if you're not dying, they will not give you IV fluids. They will not draw your blood. They will not do your chest X-ray. They will not swab you. They will send you to go home to contain your illness, your viral illness at home. So I did not like that approach at all.
Were you on Tamiflu?
I took the Tamiflu. I did not give it to my daughter because it was too late. Both of us had exactly the same duration of illness.
But you think she got it first?
And the same severity. Correct. And I have to conclude from my personal experience and from the experience of my patients, who had, many of whom had swine flu this season, that Tamiflu may not be the best way to go. And I know I will be scolded for this by the pharmaceutical companies out there.
Look, not in the strategy room. We just want to know the truth. So just tell us the truth.
My professional feeling is that it should definitely not be taken for preventive measures. Tamiflu.
So no Tamiflu for prevention.
In my professional opinion, it should not be.
And in fact, that the drug maker Roche has said that it's not made for that. In fact, you could build up a problem.
Absolutely.
Then it wouldn't work if you got it.
And some scientists believe that when you use monotherapy, such as Tamiflu alone, for a viral disease, you are promoting resistant formation, just like AZT.
You're teaching the virus.
Exactly, just like AZT did it in HIV virus.
Oh, that's
interesting. If we can avoid taking a chemical to help us fight the viral infection, which our bodies are normally geared to fight unless we're severely asthmatic people or immunocompromised.
You have a pre-existing condition, respiratory condition.
Yes. then I would not recommend taking it. But consult with your physician, please.
So let me get this straight. By taking Tamiflu, you're pretty much zoning it out with one medication, and the virus can learn that and mutate.
That's correct.
And then the other problem is, don't you have to take it in the first 36 or 48 hours or
First
something?
48 hours. And many people who are feeling a little achy and a little
I
fatigued,
don't think I'd figure out I was sick until like day 4.
Exactly.
So then it's too late anyway, and you don't want to take it then.
Well, that's right. That's right. But the thing that got me
Because it
the
doesn't
most,
work.
Absolutely. My experience taught me to, first of all, learn about swine flu from A to Z, learn about the homeopathic methods of containing it at home.
How shocked were you, though, as a doctor, to find that you actually had gotten this?
I was not shocked at all. We are exposed to germs, saliva, blood.
All the time.
It's
right.
a dangerous job.
Wow.
But,
all right. So tell me
yeah.
about this vaccine. Some of it apparently has thimerosal in it, which is the dreaded mercury that they promised us that they weren't going to use anymore.
That's
now
right.
they're using it because it's cheaper than making it without it, and they have to make so much?
That's correct. More than half of the regular influenza vaccines out there contain a certain degree of mercury. It doesn't come as a surprise that New Yorkers overall have a much higher level of mercury in our blood than the rest of the nation. I actually routinely check heavy metals in my patients' blood because we're a holistic practice, so we're concerned with
Why
environmental
do we have so much
approach.
mercury in our blood already?
My hypothesis is that we are a sushi nation. New Yorkers consume more sushi than any other city in the United
States.
That.
Oh.
And we're also extremely heavy on fish consumption.
Well, the doctors tell us to eat fish.
Absolutely. Well, one of the alternatives for people who have severely elevated mercury is to take fish oil capsules instead of fish consumption.
Okay.
But also people should, we're digressing here, but people should consult with their physician about chelating the mercury out of their blood if the level is too high. We can talk about that if you want.
Wow, that's really interesting.
But
no, I didn't realize it was that much of a problem.
I think the risks of dying from the swine flu definitely outweigh the risks of having the mercury in the vaccine affect us in a negative way. I do. So I would take the risk of
Okay, now this is going to be super, super basic, but I want to make sure I ask this because I'm seeing it reflected in some of the emails. Can I get swine flu from the vaccine?
You cannot get swine flu from the vaccine because the vaccine is live vaccine. Influenza-based vaccines, the HN protein vaccines, are synthesized by taking a protein from the outer coat of the virus and subjecting our immune system to it, thereby causing our antibodies rise as a protective mechanism against that protein. So we physically cannot get a flu from the vaccine, but we can certainly get sick because of the vaccine. Because,
oh, really?
Because the immune process itself can cause a low-grade to high-grade fever. And
so you can feel a little
You can feel achy, fluish.
What can you tell me about the lethal nature of this virus?
Well, I tell you that we've suffered a great deal from it. The numbers of the lethality, the lethal outcomes are rising. Latin America has been hit extremely hard.
Why?
It's winter time over there right now.
Oh, because of the seasons are opposite.
And,
okay. So it's already their flu season there.
That's right. And they are really severely trying to contain it. I had a patient who recently arrived at the Brazilian airport, and they had a passenger coughing on board, and the entire the passengers on the plane were told to wait until that particular passenger was swabbed by the authorities
and clean the plane.
And they said that if he tests positive for swine flu, they are going to be in quarantine for seven days.
How fast can they tell you if you have it?
Well, the swabs are immediate. However, I have noticed in my practice and in my colleagues' practices that there are a lot of false negative swabs. So the gold standard, even if the quick swab is negative, is to take a culture, which can take up to 4 days to grow on the Petri dish.
Wow, so there are a lot of false negatives.
That's right.
That's really
scary.
But
we really should be equipped to do everything.
Okay.
And
I want to move on because we have more things going on than swine flu. I understand, and very quickly, can you tell us how to have $1 meals? There are a lot of people out, I know this is such a huge segue, but there are a lot of people out there on strong budgets, and that's why I call the segment Rapid Fire. Your specialty is a buck meal, and it's not a Happy Meal. Talk to me.
The $1 meal concept, it does not exactly coincide with our ideas about what's healthy and what's not. Over a third of our nation is obese. So, when we talk about the low-cost meal, a lot of people would tend to gear towards, McDonald's, Wendy's, and Burger King, and that may not necessarily be a good approach because, we're talking about the high-fat content of the meals. And there's a study that was recently done by one of the universities in California, which revealed that positioning a McDonald's on the same block as the high school predisposed kids to obesity tenfold than the regular kids.
Sure.
So we shouldn't necessarily be going for the low-cost fast meal. Let's stick to vegetables, let's stick to fruits, balanced, healthy meals. There are a lot of healthy, cheap alternatives out there, celery, carrots,
And they fill you up. They have fiber.
They do. They really do. Fruits and vegetables have
you
a
can
lot
get
of
several
fiber.
carrots for $1. Yeah,
of course
you
can.
got to be creative.
Of
But
course.
you also have to kind of retrain your kids and your brain to want that stuff too.
I agree. It's something that
you know what my mother used to
yeah.
say? If you get hungry enough, you'd actually eat $1. So when I would want junk, and my mom would say, no, we're not, because junk is expensive, and
That's
the really good tasting junk is really expensive. So when you
But
get
it all
hungry
comes
enough,
from
you'll eat
childhood.
carrots and celery, and you can buy those things in bulk.
But our kids, like you aptly pointed out, our kids are not taught to be excited about natural foods, about
Right.
fruits and vegetables. They get
Well, like when I make my daughter a
Yeah.
grilled cheese sandwich, I put fresh tomatoes and things in, and I make my own little spread with the Cuisinart. I put steamed vegetables, put it in there, and it comes out like a pate. Put that on the bread. There's like 8 vegetables in her grilled cheese
Very
sandwich.
nice. So you're an inventive mom.
I
You're
have to
actually
be.
playing with it. But most people out there, they just
And
give
it's
their
quick,
children.
and it's cheap that way too.
Yeah. Just
Yeah.
don't let your kid eat at school, because I tell you, the kind
Don't
of
let your kid eat
the
at school, but
kind
they're
of things
there.
they feed them in school are atrocious.
Send your kid to lunch. Take the time
Give
to make
them
the
lunch. Give them lunch.
Really?
Absolutely. And
Oh,
they
that's
will feel
interesting.
somewhat of an outcast, in the beginning, but they will thank you later.
Well, your mercury, thank you for that, doctor.
Sure.
Your mercury conversation has really shaken a lot of people. Apparently, in New York City, mercury was used to in the flux to bind plumbing pipes in New York buildings for 60 years. So you live here in New York, you see a large group of people with mercury poisoning. Bill in New York City is saying maybe that's a reason why.
That could be. That
Wow,
should
I never knew
certainly
that.
be. People should also ask their physician to check the copper level in their blood, because the copper piping in the older buildings could certainly be affecting their.
We've got Dennis, who is, I don't know where 434 is. What area code is that? Dennis, great show. Thank you, Dennis. Your guess makes a lot of sense. We over-medicate in this country instead of using preventive measures. Very interesting. They like your holistic
Let's have
approach.
insurances pay for the preventive measures, guys. The CPT code 97802, nutritional counseling, is not covered anymore. How bad can it get in a nation that has over 30% obesity? If I don't have the time to talk to my patients about their diabetic diet or cholesterol, how can I help them? Just put them on Lipitor and, get the statin toxicity going? No, I'm not that kind of a physician.
That's very interesting.
Yep.
Well, and you slid in a little bit of your advice on the healthcare stuff too. Did you guys catch that?
I couldn't avoid.
She kind of slid that in. She said there's some things that are missing in the healthcare reform bill, and one of them is this preventive measure, and you even have a code number for it.
That's right.
So
That's right.
So you need to, if you can get up to New Hampshire, you can get into that town hall meeting with the president. And
Well,
you
listen,
can tell him.
AMA, the organization that's supposed to protect me, is actually wholeheartedly endorsing the bill the way it is. So,
Okay, it sounds like
what
you're
can
not
I
in
tell
favor
you?
of that.
not in the shape and form that is being proposed. I think
Dr.
it needs a lot of
Svetlana
work.
Kogan, will you come back? Because it sounds
Absolutely.
like we could talk healthcare, we could talk a whole bunch of stuff with you. I
Absolutely.
really appreciate you sharing your story about swine flu.
Thank
Now,
you
when
so
I
much
asked the
for
good doctor
having me.
here about whether or not the vaccines were safe, I had no idea you'd actually had swine flu. And a pretty nasty experience, but you're healthy and with some great advice for us this morning. Thank you. I look
Thank you so
forward
much
to having
for having
you
me
back.
and letting me talk to people, get my voice out there.
Oh, absolutely. We took a couple emails, you guys.